picture this, right? A perfectly healthy adult Great Dane walks into a veterinary clinic.
Okay.
And on paper, I mean, this is the most uneventful routine visit imaginable. The dog is eating fine, totally loves his walks, there's no limping, no collapsing.
Right.
Absolutely nothing dramatic is going on.
Yeah, for an owner walking in with this dog, you are probably expecting a very quick in and out.
Just a quick checkup.
Exactly.
Right.
You get the annual vaccine, the vet gives them a quick once-over, and you are basically back in the car.
Yeah.
It naturally raises the question of what the point of being there really is, when nothing seems to be wrong.
It totally feels like you're just checking a box on your to-do list. Like, okay, I did the vet thing this year.
Mm-hmm.
But today, our mission for this deep dive is to completely reframe how you view these boring checkups, specifically when we're looking through the lens of giant breeds like the Great Dane.
Right, because it's so different for them.
It really is. So we are pulling from veterinary care notes and expert discussions on giant breed maintenance today to show you that what seems like, a non-event is actually a highly critical, secret intelligence-gathering mission.
I love that phrase. Framing it as an intelligence-gathering mission captures the reality perfectly. I mean, it really does.
Yeah.
Yeah, because preventive care, especially for a giant breed, it isn't about going to the clinic to repeatedly confirm that nothing is wrong. It is about deliberately, intentionally building a baseline.
Okay, a baseline.
Right. You are establishing a rigorous record so that when something finally does change, and biology dictates that eventually it will.
Unfortunately.
Exactly. But you'll have the concrete data to actually recognize that shift when it happens.
Okay, let's unpack this a bit, because it's kind of like calibrating a highly sensitive scientific instrument, right?
Oh, that's a great way to put it.
Like, you can't know if a reading is off by a millimeter tomorrow unless you establish exactly where zero is today.
That is the exact mechanism at play here. Let's look at what actually happens in that uneventful exam room to establish that zero.
Okay, walk me through it.
So the dog steps on the scale. Maybe the number has crept up just a little bit, perhaps more than you even realized.
Sure.
Then the vet runs their hands over the dog. They are feeling the ribs, feeling the waist, the hindquarters.
Because Great Danes have that very short, sleek coat, which kind of gives the illusion that you can see every single change just by looking at them.
Exactly. But that short coat can quietly hide a significant loss of muscle definition if you aren't, physically getting your hands on them and feeling for it.
Wow. Okay, so they're checking the muscle.
They are. And while they are doing this hands-on check, they're also listening to the heart. They're watching how the dog turns and walks across that slippery clinic floor.
Oh, checking for mobility issues.
Right. They're looking in the mouth, checking the paws. They'll ask you questions about, how long it takes the dog to recover after a hike.
Just casual conversation that's actually, gathering data?
Completely. They might also confirm exactly where your nearest emergency hospital is and update the medication list.
So at the end of all of that, there is no dramatic diagnosis.
None.
But something incredibly valuable just happened. You and your vet built a much clearer, high-definition picture of what normal actually looks like for your specific dog on that specific day.
Exactly. And early adulthood is the absolute perfect window to establish this baseline. Healthy weight, muscle tone, normal gait, exercise tolerance. You basically lock that picture in.
But wait, I have to push back on this just a little bit on behalf of our listener.
Sure, go ahead.
Isn't it tempting for an owner to feel like they just wasted $200 if they leave with a completely clean bill of health?
Oh, yeah.
It's so easy to think, great, I just paid a premium for you to literally just tell me my dog is fine.
It is entirely tempting to feel that way. I mean, we've all been there.
Right.
If we connect this to the bigger picture, though, you aren't paying for a diagnosis. You are paying for readiness.
Readiness, I like that.
Yeah. And it is crucial to state clearly that doing all of this baseline gathering, it does not guarantee your dog won't face cancer or heart disease or orthopedic issues down the line.
Right, because biology is biology.
Exactly. Nobody controls biology completely, and we never, ever want an owner blaming themselves if disease shows up despite doing everything right.
Yeah. That's so important to remember.
Preventive care doesn't offer absolute prevention, It offers earlier recognition, and that baseline isn't a fixed forever number. It's a living reference point that will naturally shift as your dog ages.
Which brings us to the most obvious baseline number of all, right? The scale.
The scale, yes.
The notes we review point out something really counterintuitive here, which is that the scale can actually lie to you.
Oh, it absolutely can. Weight is a useful piece of data, sure, but on its own, it is incredibly incomplete.
How so?
Well, with Great Danes especially, they vary so wildly by height, by sex, by physical structure, and even just by their specific family line.
Wow.
There is absolutely no single breed-wide target weight that works for every Dane. You can't just look up a chart on the internet, see 140 pounds, and assume your dog is perfect.
So if there isn't a magic number, what are we actually looking for when they step on that metal clinic scale?
The trend.
The trend.
The trajectory is what matters. A slow, steady creep upward might mean, there are hidden calories sneaking in, or maybe the dog is naturally moving less than they did a year ago.
Oh, like they're slowing down but eating the same amount.
Exactly. And sometimes it means there's a hidden pain that is subtly limiting their movement. They don't run as much because it hurts.
That makes sense. And what if the weight is going down?
On the flip side, yeah, a slow decline in weight could point toward dental pain where it literally just hurts to chew, or a systemic issue like digestive or cardiac disease.
The psychological trap here is what really caught my attention in the research.
The normalization part.
Yes. Because huge is the baseline expectation for a Great Dane, right? As an owner, you can easily normalize your dog getting heavier because you just look at them and think, well, they're a giant breed. They're supposed to be massive.
It is so easy to fall into that trap. We easily normalize a heavier dog because we expect them to take up a lot of space. But being heavier than other Great Danes is not a goal.
Definitely not.
And here is a crucial distinction that gets missed all the time. Muscle is completely separate from weight.
Wait, okay. So a Great Dane could weigh exactly the same as they did last year. Like holding that number perfectly at 140 pounds, but actually be in significantly worse shape structurally.
Yes. A dog can hold the exact same number on the scale while quietly losing dense muscle mass and just replacing it with lighter body fat.
Oh, wow.
To spot this, you have to look past the scale. You look at the shoulders, you look at the back, the thighs. How easily are they handling a flight of stairs? How smoothly do they jump into the back of the SUV? Muscle is what actively supports the spine and those massive joints. It's not about canine aesthetics, It's about structural integrity.
So since the scale only gives us part of the story, we kind of have to rely on our own observations at home in between these vet visits. We have to essentially put our dogs under friendly surveillance.
Friendly surveillance, yeah. That home surveillance starts with nutrition, which requires brutal honesty from the owner.
Brutal honesty, because those treats add up.
They really do. When you log what your dog eats, it's not just the scoops of kibble in the bowl. It's the main diet, the chew toys that have calories, the table scraps, the training rewards.
All of it.
All of it. Portions that kept your dog perfectly lean last year might just be too much this year, especially if they've been neutered or if their daily activity has just dropped off a bit.
Right. And, the sources were very strict about one specific nutritional warning. They said, do not add calcium, joint powders, or random vitamins on your own.
Yes, very strict on that.
But they didn't fully explain the mechanics of it. Why is adding calcium so dangerous for a growing giant breed?
It really comes down to how their bodies are programmed. Giant breeds are already genetically wired for rapid, massive growth.
Like they grow incredibly fast.
Unbelievably fast. So if you artificially overload them with calcium without a vet's supervision, their bones actually begin to grow faster than the supporting soft tissue like the ligaments and tendons can actually keep up with.
Oh, man. So they grow out of sync.
Yes. And this structural mismatch leads to severe, sometimes permanent skeletal deformities.
Wow, that makes perfect sense. You're basically forcing the scaffolding to outpace the foundation.
That's a perfect analogy.
So nutrition is tightly controlled.
Yeah.
We also need to monitor the output, which is the exercise, right?
Right. And tracking exercise isn't just about noting that you walked 3 miles. It's about observing the recovery.
The recovery.
Yeah. How does the dog look an hour after the walk? How do they look the next morning when they first stand up out of bed? A dog that happily finishes a hike out of pure adrenaline might still have exceeded what their joints were actually prepared for.
Which is why the visual data you collect is so important. One of the best recommendations we came across in the research is to take occasional videos of your dog just moving normally.
I love this tip so much.
So what does this all mean for you, the listener? We are essentially acting as amateur documentary filmmakers of our own dogs. just to create a visual baseline.
It is an incredibly smart habit to get into. You take your phone and you film them walking toward you, then walking away from you.
Like from different angles?
Right, get a side profile of them just trotting in the yard, and importantly, a video of them getting up from a lying down position.
Now, to be clear, we aren't doing this to play armchair veterinarian and, diagnose them ourselves.
Oh, not at all. Please don't do that. These videos aren't medical evidence to replace an exam. They are just the ultimate visual baseline. When you have a video of what your dog's normal looks like, it becomes significantly easier to spot genuine orthopedic or neurological shifts 6 months down the line.
Let's actually dive into those neurological shifts, because the notes mention some specific red flags to look out for in that home footage. They brought up paw dragging and knuckling, and they also mentioned wobbler's syndrome. But I wasn't entirely clear on what that actually does to the dog.
Yeah, wobblers is an important condition to understand with these breeds. It's essentially a compression of the cervical spine.
So the vertebrae in the neck.
Exactly. When that spinal cord gets compressed in the neck, it interrupts the neurological signals that are traveling from the brain down to the feet.
Okay, wait, so the dog's brain is telling the foot to step normally, but the message gets, scrambled along the way?
Precisely. And that scrambled signal results in knuckling, which is when the dog's paw flips over and they step on the top of their toes instead of the bottom pad.
Ouch, that sounds awful.
It is. You might also notice scuffed nails on the middle toes just from them dragging their feet. Or you might see their back feet actually cross over each other when they turn.
Which causes that wobbling walk.
Exactly, hence the name. Now, if you see this, don't panic and try to self-diagnose, but absolutely get to a vet. Any new weakness or a change in coordination demands a professional evaluation.
Right. So we're tracking movement and diet, but let's sort of zoom in on this specific, hidden, life-threatening dangers that come with owning a giant breed. Things a normal dog owner might not even have on their radar.
Right, the big emergencies. Cardiac health care is a very high risk in this breed.
Which is why the vet spends so much time listening to the heart.
Yes, and asking about their resting breathing rate. A condition called dilated cardiomyopathy, or DCM, is a major concern here.
ECM.
Yeah, it's a disease where the heart muscle becomes enlarged, it gets thin and weakened, so it just struggles to pump blood effectively.
And a completely normal heart exam today isn't a guarantee for tomorrow, right? Because DCM develops and progresses over time.
Which makes your home surveillance so vital. You are watching for reduced stamina, sudden fatigue, or fainting.
Fainting is a big red flag.
Huge. And if you ever see your dog doing open-mouth breathing while they are completely at rest...
Wait, at rest? Like they haven't been doing anything?
Right, meaning they haven't been exercising, they aren't hot, they are literally just lying on the floor, panting heavily. That is an immediate drop-everything emergency.
Oh, wow. Okay. And I want to ask you about the other drop-everything emergency mentioned in the notes.
Yeah.
GDV, which is commonly known as bloat.
Ah, yes. The big one.
I know it's considered the absolute nightmare scenario for giant breeds, but what exactly are we looking for before it's too late, and why does it happen so fast?
So GDV stands for gastric dilatation volvulus. It happens when the dog's stomach fills with gas and expands like a balloon. That's the dilatation part, the bloat.
Okay.
The true emergency is the volvulus, which is when that expanded stomach actually twists on itself.
Oh, man.
Yeah, it completely cuts off the blood supply and traps the gas inside. It can become fatal in a matter of hours.
That is terrifying. So what are the immediate warning signs an owner would see at home?
Repeated, unproductive retching. They look and sound like they need to throw up, but absolutely nothing comes out.
Dry heaving, basically?
Exactly. You'll also see severe, uncharacteristic restlessness, like they just can't get comfortable. Excessive drooling, a tight or swollen belly, and sudden weakness.
And if you see these?
You go straight to the ER. There is no waiting to see if it passes. There is no trying to induce vomiting at home. You just go.
Now, a lot of owners opt for a preventive surgery, right? Called a gastropexy, where the stomach is tacked to the abdominal wall to stop it from twisting in the first place.
They do, yes.
And if your dog has had this, you definitely need to keep the surgical records handy. But there's a massive misconception about this surgery that we really need to clear up.
What's fascinating here is how a gastropexy can create an incredibly dangerous false sense of reassurance for owners.
How so?
Well, the surgery significantly reduces the risk of the stomach physically twisting. That's the volvulus part. But it does not prevent the stomach from distending.
Wait, really? So they can still bloat?
Yes. It does not stop the stomach from filling with gas, blowing up, and becoming a highly painful emergency. The exact same GDV warning signs apply, whether your dog has the surgery or not.
That is a critical distinction to make.
Wow.
Now, we've talked about these massive internal emergencies, but let's shift a little to how these dogs manage the daily physical reality of moving a 150-pound body through the world.
It's a lot of wear and tear.
It is. We need to talk about how they mask pain, starting with lumps and cancer.
Right. You should be doing regular hands-on checks of your dog. If you find a lump, track its location, its size, its shape, take a photo next to a coin for scale so you know if it's growing.
That's a good tip.
But please do not squeeze them, poke them, or try to drain them yourself. You cannot tell if something is cancerous just by feeling it.
And cancer doesn't always show up as a lump, either. The sources highlight that persistent lameness, like a limp that just won't go away, should never just be continually written off as a muscle strain in a giant breed.
Given the breed's risk profile, a recurring limp could actually be an early sign of bone cancer.
Yeah, that's scary.
It is. And these dogs are incredibly stoic, so a persistent lameness warrants an actual investigation by a vet, not just, a few days of rest on the couch.
Speaking of how well they hide things, let's talk about how they mask pain in other areas,
Yeah.
like their mouth.
Oh, dental pain.
Yeah, because we naturally assume that if a dog's teeth hurt, they'll just stop eating.
Right. But this raises an important point about survival instincts. A dog, especially a large breed, will absolutely keep happily eating their dinner, even if their mouth is in genuine agony.
Really, they'll just power through it.
They will. You have to watch for the subtle clues instead. Are they suddenly dropping kibble on the floor while they eat? Are they favoring one side of their mouth while chewing? Have they completely stopped touching the hard chew toys they used to love?
That's wild. Keep human toothpaste far away from them, by the way.
Yeah.
And ironically, those super hard bones and antlers people buy for big dogs can actually fracture their teeth.
Yes. Avoid those.
So that stoicism applies to their whole body, which just takes a massive mechanical beating moving around. Let's talk about their skin and paws.
The short coat of a Dane is actually a massive advantage here. Because the coat is so short, you can easily spot redness, hair loss, or recurring sores.
Which ties directly into their bedding.
Yes. For a Great Dane, high-quality supportive bedding is not a luxury item. It is literally preventative medical care.
It's like maintaining a heavy-duty freight truck. Right. The suspension, which is their joints, take so much incredible force.
Exactly.
When a 150-pound dog lies down on a hard floor, their elbows, their hips, their hocks, they're taking immense sustained pressure.
And over time, that pressure damages the skin and the joints. You'll see hair loss or thick, calloused skin at those contact points. They need orthopedic support to disperse that weight.
And going back to the freight truck analogy, let's look at the tires.
Their paws and nails.
Yes, they are huge indicators of mechanical health. The note said that if you are trimming their nails and you notice that the nails on one foot are wearing down unevenly or maybe scraping on one side, that actually reflects a hidden change in how they are walking.
It does. It's such an incredibly subtle clue, but a scraped nail tells you their gait is off long before you might notice a limp.
We've covered the internal hardware and the physical wear and tear, but you could do all this monitoring and it still completely falls apart if your external infrastructure isn't prepared for the sheer scale of a Great Dane emergency.
Oh, absolutely. The logistics of giant breed care are extremely unforgiving.
Where do we start?
First, records and medications. You need exact lists. Never casually combine different flea, tick, or parasite preventives without talking to your vet.
And never use human medications, obviously.
Right. And supplements like fish oil, probiotics, or herbal joint formulas need to be tracked too.
Even the natural stuff.
Yes. Just because a label says natural does not mean it is automatically safe. These supplements affect daily caloric intake, they can alter digestion, and they can interact with prescribed medications.
That's a great point. You also want to keep track of genetics and family history, like hip and eye screenings. But the notes specifically mention thyroid screenings. Why does thyroid function matter so much for a giant breed?
So, thyroid function regulates metabolism. If a giant breed develops hypothyroidism, meaning their thyroid is underactive, their metabolism just crashes.
Okay.
This leads to profound lethargy and rapid weight gain. And if you remember our earlier discussion about how dangerous excess weight is for their joints.
Oh, yeah, the structural integrity.
Right. You can see why catching a thyroid issue early is critical to their overall health. Family history of these issues doesn't give you a crystal ball, of course, but it gives your vet vital context.
Let's talk about the elephant in the room now, the finances and the transport.
Yeah, we have to talk about this. Great Dane care gets genuinely expensive, incredibly fast.
Just because of their size.
Mostly, yeah. It's basic math. Every medication, every unit of anesthesia, every single antibiotic is dosed by weight. Treating a 150-pound body is completely different financially than treating a 30-pound body.
Right, it's like 5 times the amount of medicine.
Exactly.
Wow.
You need pet insurance or a dedicated substantial emergency fund. You do not want to be making literal life or death decisions based purely on what's in your checking account during a crisis.
And then there's the transport test. Listeners, I want you to think about this right now. You can't just scoop a 150-pound dog into the backseat of a sedan if they suddenly can't walk.
No, you really can't.
Your logistical plan has to match the size of the animal.
You have to know, today, before an emergency ever happens, which vehicle can actually fit your dog if they cannot stand up. Do you have a ramp?
And have you actually practiced using that ramp while the dog is healthy?
Exactly, because doing it for the first time when they're in pain is a nightmare. Who is your neighbor or friend that can immediately come help you lift a dead-weight giant breed?
You do not want to figure out your dog can't fit in your car at 2 a.m. when they are bloating and every single minute counts.
No, you don't.
This is exactly why cooperative handling is so critical. Training your giant dog to happily tolerate having their paws touched, having someone look in their mouth, stepping onto a scale, or walking up a ramp.
It isn't just a fun potty trick.
Right. That training is the fundamental bedrock that makes all of this preventive care even possible.
Because without a cooperative dog, gathering any of this baseline data or managing a transport emergency becomes a stressful, sometimes impossible battle.
So let's bring it all back to that uneventful vet visit we talked about at the very beginning.
The one where nothing happened.
Exactly. The clinic doors open and your dog walks out. To the rest of the world, the dog looks the exact same. Nothing dramatic was cured. But you, the owner, you are walking out transformed.
You really are.
You are armed with a current, accurate weight. You have an honest assessment of their body condition and muscle mass.
Yeah.
You have a movement baseline on your phone.
Right.
You have an emergency transport plan waiting in the wings.
And as the years go by, you will watch that muzzle go a little bit gray. You will notice their stride gets just a little bit shorter. They will sleep deeper than they used to.
Yeah.
But their desire to be involved, their spirit, that remains. Because you have diligently built this baseline over time, you can finally answer the most difficult question in pet ownership.
Which is, which of these changes are just normal aging and which ones shouldn't be written off?
Exactly.
It's the ultimate tool for giving them the grace they deserve as they age. Now, to help you actually manage all of this data, our sources mandate that we let you know you can keep all these health records, medication lists, and care routines organized using the Vital Pet app.
It's super helpful.
Yeah, we put a link to download it right in the description. We also must state clearly, this deep dive is for educational purposes only. If you are concerned about your dog's health, always consult your veterinarian.
It is always the safest and best approach for your dog, period.
Period. We'll leave you with one final thought to mull over today. We've just spent all this time talking about the extraordinary lengths we go to for our dogs.
Yeah.
We rigorously track their physical baselines, their movement trends, their behavioral shifts. We analyze how they handle a simple walk. We calibrate their care so they can age as gracefully and pain-free as possible.
We do.
So, why are we humans so notoriously terrible at tracking our own physical baselines until something in our own bodies is already completely broken?
It's a profound double standard, isn't it? We are their best advocates, but rarely our own.
Very true. Until next time, keep observing, keep tracking, and give those giant pups a big pat from us.